If you are over 60 and every time you sit down, your face tightens from pain, I want you to stay with me for a few minutes. If driving has become miserable, if church seating feels unbearable, if dinner at the table turns into a battle with your own leg, I understand how exhausting that can be. I am Dr. Alina Serratia, and I want to tell you something that may change how you look at this pain. What you are feeling may not be just normal aging. It may not be something you simply have to accept. There may be a hidden reason behind that burning, stabbing, or electric pain running down your leg. And for many people, that hidden reason starts with a deficiency the body has been trying to live without for far too long. I have seen many older adults blame themselves for this pain. They think they sat too long, walked too much, lifted something wrong, or simply got old. Then they are told the same thing by others. They hear that this is just wear and tear, just bad luck, just a part of getting older. But I want to slow that thought down right now. Pain that shoots from the lower back into the hip, thigh, calf, or foot is not always just a simple back problem. Sometimes the nerve is irritated because it is not being supported the way it should be. That means your body may be dealing with more than pressure. It may also be dealing with weakness inside the nerve itself. And that is where this conversation becomes very important. Before I go deeper, I want you to think about your symptoms honestly. Does your pain burn like fire in the calf or foot? Does it shoot like a sudden bolt when you stand up? Do you feel tingling, pins, and needles? Or numbness that comes and goes? Does your leg feel weak when you climb stairs or get out of the car? If any of that sounds familiar, then what I am about to explain may help you understand your body in a way no one has explained before. I also want you to tell me in your own mind what your pain feels like most. Is it burning, shooting, numbness, tingling, or weakness? That answer matters because nerve pain often has a very clear language if we learn how to listen. When people hear the word sciatica, they often imagine one thing only. They think about a disc in the back pressing on a nerve. Yes, that can happen, and it happens often, but sciatica is really a pattern of nerve pain that follows the path of the sciatic nerve. This nerve is the longest nerve path in the body. It begins in the lower spine, travels through the buttock, goes down the back of the leg, and reaches all the way toward the foot. That is why sciatica can feel like one long line of misery. It may begin in the back, but it does not stay there. It travels, and when it travels, it can make simple daily life feel like a punishment instead of a routine. One of the hardest parts of sciatica is that it does not act like regular muscle pain. A sore muscle can ache in one place and improve with rest. Nerve pain is different. It can burn when nothing hot is touching you. It can stab you when you move only a little. It can make your toes tingle, your calf twitch, or your foot feel half asleep. It can wake you up at night and make you afraid of chairs, car seats, and long conversations at the table. Some people even begin avoiding family events, road trips, and social gatherings because they know sitting too long will make the pain explode. That is why this issue affects far more than the body. It affects freedom, confidence, sleep, mood, and the joy of everyday life. Now here is the part most people never hear. Sciatica may begin as a mechanical problem, but it can become much worse when the nerve is nutritionally weak. I want you to hear that clearly. A nerve that is poorly nourished is more sensitive, more inflamed, and less able to recover. So even if there is some pressure in the spine or irritation in the lower back, the reason the pain feels so strong may be that the nerve does not have what it needs to protect itself. In other words, what looks like a back problem alone may actually be a back problem mixed with a nutrition problem. That shift in thinking is powerful because it opens a door that many people did not know existed. Relief may not come only from stretching, resting, or injections. It may also come from feeding the nerve correctly. I want you to imagine your nerve like an electrical wire in your home. Inside that wire, a signal needs to move cleanly and safely from one place to another. Around that wire, there must be protection. If the wire is damaged or the insulation becomes weak, the signal no longer behaves normally. It may flicker, misfire, or become unstable. The same thing can happen inside the body. Your nerves need protection, energy, and repair support. Without that support, messages can get noisy, pain signals can become louder, burning can become stronger, tingling can become more constant. Weakness can begin to show up in places that once felt normal. That is why the health of the nerve itself matters so much. A nerve that is nourished behaves very differently from a nerve that is running on empty. One of the most overlooked pieces of this puzzle is vitamin B2, also known as riboflavin. Most people have heard of vitamin B12. Many have heard of vitamin D. But almost no one talks about B2 when older adults are dealing with nerve pain, burning feet, mouth cracks, light sensitivity, or a strange mix of weakness and irritation. Yet, B2 is deeply involved in the body's energy systems and protective functions. Your tissues use it every day to help create usable energy and support normal cell function. When levels stay low for too long, the body starts struggling in quiet ways. The skin can show signs. The mouth can show signs. The eyes can show signs, and in some people, the nerves may become more vulnerable and more easily inflamed than they should be. This is why I call B2 one of the hidden villains in this story. I do not mean it is the only cause of sciatica. I do not mean every person with leg pain has a B2 problem. What I mean is this. When B2 is low, the nerve system may lose part of its ability to stay calm, protected, and efficient. Then pain becomes easier to trigger and harder to settle down. If the nerve is already under stress from age, inflammation, poor circulation, or pressure from the spine, the effect can be much worse. That is when someone says, "My scan does not look terrible, so why do I feel terrible?" The answer may be that the nerve is not only pressed, it is also underfed. And a poorly nourished nerve will always complain louder than a well-supported one. But I want to be very honest with you. This is rarely about one vitamin alone. Nerves are not built or maintained by a single helper. They depend on a family of nutrients working together day after day. Vitamin B12 is very important for nerve repair and healthy nerve covering. Vitamin B1 helps with nerve signaling and energy use inside the cells. Vitamin B2 helps the body manage energy and supports systems that protect tissues from damage. When more than one of these is low, the whole network begins to weaken. That is why some people have symptoms that seem scattered at first. They have burning in the foot, numbness in the toes, weakness in the legs, poor balance, low energy, mouth cracks, and restless sleep. It feels unrelated, but the body may actually be telling one connected story. Because of that, I usually do not think in terms of one miracle nutrient. I think in terms of restoring balance. A full B complex often makes more sense than chasing one vitamin by itself. These vitamins work together like members of the same team. If one is missing, the others cannot do their best work. If several are low, the system struggles even more. So when people ask me if they should take only one single B vitamin, I often say that the better question is whether the whole nerve support system is being rebuilt properly. That is a very different approach. It is calmer, wiser, and more complete. Instead of forcing one tool to do every job, we give the body the full set of tools it uses naturally. That is often where real progress begins. There's also one special form of support I want you to know about, especially if you have burning feet, tingling toes, or nerve discomfort that seems to live in the lower legs. That form is called benfotiamine. It is related to vitamin B1, but it behaves differently in the body and is often used because it is absorbed in a way that may support nerve tissue more effectively for some people. I do not say this as hype. I say it because many people with stubborn nerve symptoms have never even heard the name. If your pain has a fiery, buzzing, or pins and needles quality, benfotiamine is worth learning about. It is not magic, and it is not instant, but for some people, it becomes a very useful part of a larger nerve support plan. I also want to set honest expectations here, because false hope helps no one. Nerves usually do not heal in 3 days. When a nerve has been irritated for months or years, it needs time. Some people begin to notice changes in 4 to 6 weeks. The first signs are often small but meaningful. The burning may calm down at night. Sleep may improve. Sitting may become slightly easier. Getting out of bed may not feel as sharp or frightening. Then, with steady support, deeper healing may continue over the next 3 to 6 months. That is why patience matters so much. Many people quit too early and assume nothing is working, when in truth, the nerve was only just beginning to respond. Healing is often quiet at first. You have to stay with it long enough to see it unfold. Now let us talk about why adults over 60 are at such high risk for these deficiencies, even when they believe they eat well. The first reason is lower stomach acid. As we age, stomach acid often decreases. That matters because stomach acid helps break down food and release nutrients so the body can absorb them properly. If acid levels are too low, the meal may look healthy, smell wonderful, and still fail to nourish you as much as you think. That is especially important for vitamins connected to nerve health. A person can have eggs, meat, vegetables, and dairy in the diet, and still slowly slide into deficiency because the digestive process is not strong enough to unlock and absorb what the body needs. This is one of the quiet changes of aging that many people never hear about. The second reason is medication. Many older adults take acid blockers, diabetes medicine, water pills, or several prescriptions at the same time. I am not telling you to stop any medication. That is not my message. My message is that medicines can change the nutrition picture. Some can reduce stomach acid. Some can interfere with absorption. Some can shift how vitamins are used or lost over time. That means a person may be doing everything right and still end up depleted. This is one reason I do not blame people when deficiency shows up later in life. It is not always about poor choices. Sometimes it is about years of slow interference happening in the background while no one is checking what the nerves actually need to stay healthy. The third reason is the gut itself. The intestine has to absorb what the stomach and diet provide. If the gut lining is inflamed, weakened, or damaged, that absorption can become unreliable. Years of digestive trouble, chronic inflammation, bowel disease, poor gut health, or repeated stress can all reduce how well nutrients get from the plate into the bloodstream and then into the tissues. So when someone tells me, "I eat fine, so I know I cannot be low," I gently remind them that eating and absorbing are not the same thing. What matters is not only what goes in your mouth. What matters is what your body can take in, use well, and deliver to the nerves. That difference becomes more important with every passing decade. There are also visible clues that can point us toward a riboflavin problem, and I want you to pay attention to them because they are often missed. If the corners of your mouth crack often, if your tongue looks red or feels sore, if bright light bothers your eyes more than it should, if the skin around your nose becomes oily or irritated, or if your heels split and stay rough, your body may be dropping hints. Some people notice weakness in the limbs. Some notice strange hearing issues. Others say they just do not feel right, but they cannot explain it well. These signs are not proof by themselves, but they are clues. And when those clues show up alongside nerve pain, tingling, or numbness, I start thinking much more seriously about whether a hidden deficiency is helping drive the problem. I want to pause here and say something very simple. Your body is smart. It often sends small warnings long before it sends major damage. The problem is that most people are taught to ignore those warnings. They treat the cracked lips, the sore tongue, the tired legs, the burning feet, and the sleep trouble as separate issues. But the body does not always divide problems the way we do. Sometimes it is speaking one message through many symptoms. That is why I urge older adults to step back and look at the full pattern. Do not ask only what hurts today. Also ask, what has my body been trying to tell me for the last 6 months? That question can open your eyes to connections that were there all along. So what does a practical support plan look like when you want to help the nerves without making things complicated? I usually think of a good B complex as the foundation because it gives broader support instead of placing all the hope on one bottle. Then, depending on the situation, extra support may include riboflavin, standard thiamine, or benfotiamine. Vitamin B12 also deserves strong attention, especially in older adults, in people taking certain medications, and in those dealing with numbness, weakness, or balance changes. Many prefer the methyl form of B12 because it is an active form often used for nerve support. The goal is not to flood the body with endless pills. The goal is to restore what is missing, support repair, and create a steady environment in which the nerve can begin to calm down. There is one caution I need to give very clearly, and that is about vitamin B6. People often assume that if a little is good, more must be better. That is not always true. B6 is important for nerve function, but large amounts over time can actually irritate nerves and cause problems of its own. That can confuse people badly because they start taking something for nerve pain and then unknowingly make nerve symptoms worse. So please be careful. Read labels. Notice how much B6 is in any product you buy. Respect safe limits, and do not take high amounts casually just because you are desperate for relief. Desperation makes people easy targets for bad decisions. Calm, informed steps are much safer, and they are far more likely to help you in the long run. When it comes to taking these supplements, simple habits matter. Taking them with food is often easier on the stomach and easier to remember. If your urine turns bright yellow, do not panic. That can happen with riboflavin, and by itself, it is often normal. What matters more than color in the bathroom is the trend in your symptoms over time. Are you sleeping a little better? Is the burning waking you less often? Is the numbness less intense? Can you sit a little longer before the pain starts shouting? Those are the questions I want you to watch. Healing does not always arrive like thunder. Very often, it arrives like a slow sunrise. If you are not paying attention, you may miss how much has quietly improved. Food also needs a place in this conversation because supplements work best when they do not stand alone. Your nerves and tissues benefit from real foods rich in these nutrients. Eggs, beef, liver, fish, mushrooms, cheese, nuts, and leafy greens can all help support the system. I know not everyone likes every food I just named, and that is fine. The point is not perfection. The point is to bring real nourishment back to the table. Supplements can fill gaps, but food lays the foundation beneath them. When someone lives on toast, snacks, sweet drinks, and small portions of low-protein food, no supplement can fully undo that pattern. Nerve healing asks for building materials. The body needs a reason and a way to repair. Food gives it that reason every single day. As you begin supporting your nerves, I want you to track progress in a simple way. Once a week, give your pain a number from 1 to 10. Then ask yourself whether the burning is less, whether the numbness is changing, whether the tingling is shorter, and whether your sleep is improving. You can even pay attention to how long you sit before discomfort starts. This matters because older adults often say, "I do not think anything changed," while their weekly notes show real progress. Small gains are easy to miss when you live in the body every day. Tracking helps you see truth instead of mood. It also keeps you steady because you stop chasing quick fixes and start noticing real healing. That kind of patience can make the difference between quitting too early and finally seeing the body respond. Now, I need to bring in an important reality check because I never want hope to become denial. Sciatica can absolutely be caused by a herniated disc, spinal narrowing, bone changes, or other structural problems. If you have severe weakness, sudden worsening, loss of bowel or bladder control, or symptoms that do not improve despite a fair trial of support, You need proper medical attention. Imaging may be necessary. A full exam may be necessary. Nutritional support can strengthen the nerve and improve its ability to cope, but it does not erase every physical problem in the spine. Wisdom means holding both truths at once. The nerve may need nutrients, and the back may still need evaluation. These ideas do not cancel each other. Very often, the best path is a balanced path that respects both the structure and the chemistry. I also want to speak to the emotional side of this, because long-lasting nerve pain changes the way people think and feel. It makes them cautious. It makes them afraid of chairs, car rides, and stairs. It can make them pull away from friends and family because they do not want to explain the pain again. Some start to believe their life has become smaller forever. If that sounds like you, I want you to hear me clearly. Pain may be loud, but it is not always the final word. The body can change. The nervous system can calm down. The tissues can rebuild more than people expect. You are not weak because pain has worn you down. You are human, and your body may simply be asking for support it has not been getting. There is dignity in recognizing that and taking action. So if I were putting this into one clear daily message for you, it would sound like this. Support the full B family with a good B complex. Give attention to B2 and B12. Consider benphotiamine if burning and tingling are major parts of your story. Eat real foods that nourish the body. Stay consistent long enough to let the nerve respond. Be careful with B6 and avoid reckless doses. Watch your symptoms honestly. And if progress does not come or if dangerous symptoms appear, seek proper medical care. That is not fear. That is wisdom. The best outcomes often come from people who are both hopeful and careful, both proactive and sensible. That is the spirit I want for you. I want to leave you with a challenge, because change does not happen through information alone. It happens through action. Give your body 6 steady weeks of real support if your healthcare situation allows it. Not 3 random days. Not 1 bottle taken only when you remember. 6 honest weeks. Pay attention to your pain, your burning, your numbness, your sleep, and your strength. Watch for the small signs. If you begin to notice relief, do not keep that story to yourself. Share it, because many other people your age are sitting in silent pain, thinking nothing can help them. Your experience may become the encouragement that helps someone else take the first step toward healing. And from my heart, I want to say this: nerves need nutrients. That is not a trend. That is biology. Deficiency is more common in older adults than many people realize, and it can hide behind ordinary complaints until the suffering becomes intense. If this message sounds like your life, do not ignore it. Do not tell yourself it is too late. Do not assume that pain is your new identity. I am Dr. Alina Serratia, and I believe the body can often recover more than people expect when it is finally given the support it has been missing. Healing is possible. Relief is possible. And sometimes the first real breakthrough begins when you stop calling it normal aging and start calling it what it may really be: